That's okay. I'll do that. And the last award for this evening is an appreciation award in the medical field to a very distinguished gentleman who has given and excelled in an industry which is very close to his heart, giving all of his valuable time and expertise unconditionally, and always has the personal care of his patients. He's a true humanitarian, a person we are referring to as Professor Charbel Sandroussi, who I know a lot of people would know here today. Dr. Sandroussi worked in regional and remote communities, including Aboriginal communities in the Solomon Islands. He's performed liver, kidney transplants and complex cancer surgery, predominantly in the RPA, Lifehouse, the Mater, and other hospitals around the country. He's well awarded and he's the head of his department at the University of Sydney. Let us now watch a video about Professor Sandroussi.
So my name is Charbel Sandroussi. My parents came to Australia on and off from the late 1960s and came to stay in the mid-1970s, just before I was born. My parents worked very hard whilst we were growing up. There were 5 children. We were lucky enough to get educated in the Catholic system near our house. We had a very good group of people around us who were good role models as far as study and academic endeavour was concerned. My parents were, always very supportive and made me understand the value of hard work. And I was fortunate enough to do reasonably well at school and get into medicine. I was always interested in sciences, and I was also interested in vocational work, and that's sort of part of the reason why I did medicine. Some of the really important things that have gone on in medicine is the automation of a lot of the processes that we have, introduction of technology and both laparoscopy and robotic surgery into our practice. And more recently, there's the use of artificial intelligence and machine learning, and we've got a program for that in our hospital. And we are sort of at the forefront of doing research using artificial intelligence and machine learning to help with the diagnosis and solid cancers of the pancreas and liver and kidneys. And we expect this to expand. I think ultimately it's going to help our decision making and help us plan how we manage patients and what treatments we give patients after they've had their surgeries. In our hospital as well, we do all the liver transplants in New South Wales. We were the first in Australia to start doing adult-to-adult live donor liver transplant about 10 years ago. We've got an active adult-to-child liver transplant program, which has been very important for some of the young children who have had liver failure. We're very lucky in Australia. Our medical system is probably the best in the world, for a number of reasons, mostly related to access to healthcare. Unlike other countries where certain aspects of healthcare are limited to your insurance status or your ability to pay for treatments, having the combination of public and private sector healthcare also enables some of the stress to be taken off the public system. There's more access for everybody throughout the country. Medicine's one of those areas which development never stops. And I think as we have a greater interaction with the biotechnology companies, engineers, and we understand more about assessment and being able to manage massive amounts of data, we're going to be able to better predict how people are going to respond to treatments and also affect better outcomes for the patients in the long term. I think in medicine over the next 15 to 20 years, the most exciting progress is going to be made with the interaction between technology and the sort of medical fraternity. We're starting to see that now with access to large data sets and also access to large amounts of data for individuals, whether it's on the basis of genetics, proteomics, tumour biology, or other things for non-cancer diseases. We're going to be able to have patient-specific treatment, which is evidence-based for each person and each disease.
I'm a bit biased up here. I've known Professor Sandroussi ever since he was a baby, so his mum looked after me when I was a baby. That's going back a long, long time ago. So may I now call upon Professor Charbel Sandroussi to come up to the stage and for his Appreciation Award.
Sort of been forced to say a few words. I'm not really great at receiving awards, mostly good at working. It's very nice to be invited here, and it's quite humbling to be present amongst a whole bunch of successful people from our community. The Lebanese diaspora around the world has always been pretty successful wherever they've landed, and I think a lot of the success is based on the sacrifices of the people that come before us, and the first people who come to these countries. And I've certainly witnessed the sacrifices that my parents and my aunts and uncles made when they first arrived, and I think it's evident in the other people who have won awards and all of the other successful people who have been present here in the room today, that they really owe their success to the people who have helped them and the people who came here before us. You know, I think we sort of stand on the shoulders of our parents and our grandparents who really suffered and sacrificed for us to get here. You know, our lives are pretty easy compared to a lot of the other people around the world. So I think we should all be grateful, and thanks very much for the award.
We'll just invite the other award recipients to come up.